Good evening and welcome to Feet Forward with the Illinois Podiatric Medical Association. My name is Chris Martin. With us today is a three-time guest of the show, old-time friend of the show, Bela Pandit. Dr. Pandit is a podiatrist from Evergreen Park, but she resides here in Chicago, right in the neighborhood, right?
Yes, pretty close
You're
by.
not too far within walking distance of the fine studios here at CAN TV. Tell us a little bit about your practice, how things are going. You've been in practice for about 5 years now?
6 years.
Six
years. I'm out in Evergreen Park. And
Thanks for that anniversary card, by the way.
Oh,
That was
okay.
nice. That was a nice party.
I have a multi-dimensional practice. I see everything from little children to geriatrics, cosmetic procedures to surgical procedures. It's very well-rounded. Anything foot and ankle, I take care of it.
And you were telling me before the show you're busy.
I'm very busy. And usually this time of year, it's more fractures and injuries due to ice and snow, but we've had a mild winter, so it's regular foot ailments, not really related to that.
That's cool. How was your Valentine's Day?
It was good. How was yours?
Wonderful. Very quiet. Since this is Valentine's Day +1, we're going to give the women another day and focus on women's health
All right.
and women's foot health issues because, let's face it, women don't get enough attention.
True.
I think we can all agree on that.
True.
So we're going to talk about some basic things, including one of the staples of a woman's day out, the mani-pedi. We're not going to talk about the mani, just the pedi today, right?
Oh, yes, exactly.
So you're going to share a few tips about that, and then we're going to talk about shoes, how to buy the right shoes, why high heels are bad for women in excess, like many things. And then we'll talk about some new cosmetic procedures if we have time left in the show. We do welcome your calls. The number is 312-738-1060. And if you do not have a podiatrist and are looking for one, you can go to the website, which is right on the sign back there. That's IPMA.net. Or if you prefer the phone, 888-869-3338. You'll get a few references or referrals to IPMA members in your area. Probably, I'm guessing the way most men are, they were lavishing their women with gifts.
Yes.
And perhaps some of them got
Some
gift
spa,
certificates
yes.
to maybe a spa or two.
Yes.
And so they're going to get a mani-pedi.
Mm-hmm.
And so you've got some tips here for women that are going to get a pedicure, and some things to stay safe, because infections do happen at these places. As hard as they try to create a sterile and safe environment, that's not always the case. So why don't you talk to us a little bit about ways women can get a nice experience that's also safe and infection-free?
Easy enough. Well, the key is look where you're going. If you walk in and it looks dirty and there's stuff on the ground and it just looks unsanitary, walk out. That's the first rule. Let's say you're going to a spa, you're using those gift certificates your husband or significant other got you, and the place looks decent. A couple of things to think about. You may want to engage and think about bringing in your own instruments, because you really cannot tell how an instrument is sterilized. Sometimes it's sitting in the blue liquid. You can't tell when that liquid was changed. Some people take it out of a boiler type of machine. We don't know what degrees that is at. That's not a medical sterilizer in most cases.
Mm-hmm.
So a couple of things to think about in terms of instruments is your nail clippers. And I have a pair here.
So hold those up so everyone can see it there.
They are economical enough to get plenty of them. If you frequent a spa or a nail salon, just leave it there with your name on it. A lot of places are very used to that. Anything that comes in contact with your nail is at a high risk for getting a fungal infection or a staph infection or something you're not desiring. So it's good to bring your own instruments.
What is this? This is a heavy duty one, a little bigger than the one I have at
Yes.
home. But what does this run? A few bucks?
Yeah, about $3 to $5 tops.
You can get these at Costco's or Walgreens or.
Just make an investment, because otherwise you'll be spending more money trying to fix your problems that you catch from these places. There's a lot of controversy out there about cuticles. Here's a cuticle nipper. I don't recommend getting your cuticles nipped. Some people have very large cuticles and they do want to get them cut. Bring your own cutters for that. If you can, have the salon person actually push back your cuticles instead. There's been celebrities in the news and famous people that have gotten severe infections from getting their cuticles cut, so you don't want to be one of those people.
What are the pros and cons of that?
Well, basically, there's an aesthetic look that if you get it cut, it looks a little bit more refined, a little cleaner. It's just not worth it. It's absolutely not worth it.
Yeah.
Pushed back looks just as good, unless you are really staring at someone's cuticles. No one would know but you. Nail files, a lot of the top salons just give you your own and you go home with it. But if you're in a salon and you see one half of the file is used and then they're using the other half on you, don't use it. Just tell them no. Because
Ask for a new one.
Ask for a new one, because if they use one side on someone, if they had fungal nails, that fungus can transfer to the clean side. So it's no longer clean. I think this is one area that people don't think about. This is the clear base coat they put on before a color. That base coat is used on everyone. So the person before you that may have had green or black toenails is also using that same base coat. So bring your own base coat if you can. This is a medium range one, but you can get them from 99 cents to about $10 depending on what your goal is with these base coats.
What is the role of the base coat in the pedicure?
It basically lets the color adhere to the polish.
Like
and
a
then
primer.
Like a primer. Exactly, like a wall primer, pretty much. And if you're wearing dark colors, it doesn't allow the dark colors to stain your nails.
Now, I read something yesterday about if women are being treated for an infection of any kind, or they think they're have some sort of infection or toe problem, they shouldn't be using either a clear coat or a nail polish. Is that right?
Well, technically you should, if you're using any kind of pills or ointments for your nails, you should probably just leave your nails bare at that point, because the more you occlude the nails, the less air they're going to get, and you can't even see the progress of what you're doing if they're covered with polish. So. And then the last thing is a toe separator. Most places give you one that you wear and you could wear out the door and you could throw out. Some places want you to give them back to them. I wouldn't trust those places. Okay, I would just walk out on that too. So.
Now I know they sell these in kits that a woman could buy, sort of as a standalone sort of thing. But you don't recommend that, do you? You recommend getting them separate?
I recommend getting them separately, because usually the kits, although they seem like a good price and the things are bundled together, usually low-grade instruments or low-grade files. So you just spend a couple extra dollars and get things separately. You'll be happier in the long run.
Okay, great. All right. Again, we welcome your questions. Feel free to ring us up at 312-738-1060. We are talking about women's foot health today, but we will be happy to answer any question you might have about your foot care topics. The next thing, of course, once you get your toes taken care of, you're going to need to get some shoes, right?
Yeah, you got to show those
Come on, right? We all know that.
So, well, the big, obviously the kind of shoes most podiatrists recommend is something flat. These are jazzy, flat shoes, sparkly. So they're comfortable yet fashionable. Something like this is ideal. Nice rubber sole, not much of a heel, comfortable to walk around in for long periods of time.
But you're not going to see that shoe on the red carpet at the Oscars.
No, you're not going to see that at the red carpet. You're going to see a high heel, and women want to wear high heels. And as we mentioned before, in moderation is key. When we're looking at heels, you can do it two ways. This is your classic stiletto heel. Comfortable for maybe about a half an hour for most people. They look great. It's great for photos. They kind of give you an elongated leg and a different way that you stand.
I hadn't noticed, really.
Yeah, I'm sure. And then there's something like this, which is a wedge heel, which is a lot more comfortable. You can wear them for several hours at a time. This is an ideal high heel if you're going to be wearing a high heel. You don't have any side-to-side motion. You'll feel a lot more stable in this. Even in inclement weather, it's a little bit sturdier to have something like this. The problem with shoes like this and why they can damage your feet, and people who wear them 8 to 12 hours a day, is that they thrust all your weight to your forefoot. So you start getting forefoot pain, your toes get squeezed with the narrow toe box here, and then of course you can get heel pain and Achilles tendon shortening in the back, which can cause a lot of pain in the back of your heel as well. Not to mention, it's not the most stretchable shoe so it can rub on your skin as well.
I think we have our first caller of the evening. Go ahead, you're on Feet Forward. How can we help you?
Hi, good evening.
Hi.
Hi.
My question is, I'm female, 6'1". My weight is appropriate to my height, and I exercise every day. I do weightlifting and I do jogging. For some time now, I have had a problem with my left foot, maybe from the end of the small toe to not through the heel, but like right before you get to the heel. And I think it may be related to my shoes. I wear 13, but I have a narrow foot, and most shoes seem to be too wide. But when I'm just walking, not working out, I kind of feel it's not really painful, but it's uncomfortable. And I've noticed if I don't run for a couple of days, that the uncomfortability goes away. So I was wondering if you could have, if you had some suggestions that I could try.
Could you make out that question?
The very last end, it's about the shoe. I understand you're wearing shoes and you have some questions about the shoes and you're getting some little toe pain there, and you have a narrow foot that's a little bit bigger, so it's probably hard to fit as well. What it sounds like you're getting is some kind of tendon pain. You also may be getting some friction on the little toe. Even if you get a narrow cut shoe, or it may not be wide enough for you, believe it or not, in the toe area, so that could be an issue. If you get a normal width, that might be too loose for you, and that can be causing some friction on the side of your foot as well. One thing that you can do is definitely go to your local podiatrist. You can find us through the IPMA and get properly sized for shoes, as well as maybe getting something like an orthotic insert that will control and balance your muscles while you're working out, because I think it's wonderful that you're working out regularly and you should not have to stop that for toe pain. That's one of our big beliefs. Your feet should be happy, you should be comfortable. So it might be worth your time to actually see a podiatrist and get a judgment call from there, and that way your pain will be relieved as well.
Okay, thanks for your call. I know some of the better running shoe stores and athletic shoe stores will do better foot measurements too.
Yes.
As opposed to maybe a department store or
Yes.
something like that. Not that I didn't sell shoes when I was a kid, I didn't certainly measure as accurately as I probably could have. But yeah, you can get a better measurement from an athletic shoe store.
Definitely, and there's always one or two in every area that are reliable and do a great job with fitting, especially for highly active runners or people who work out a lot. They take their time with shoes like that, and there's so many shoes out there that sometimes it's easy to get lost in what's out there.
It's a good segue back to our talking about shoes. When women go and shop for shoes, there are certain times of the day that are actually better to try shoes on, right?
Right. You want to try your shoes on at the end of the day. Regardless, your foot's going to be a little bit swollen and a little bit bigger at the end of the day. Particularly on days that you lead a normal life, your working days, when depending on what you do. You don't want to maybe try on a shoe right after you ran the marathon. That doesn't make sense. Your foot's not always going to be that way. So that's the best time to try it on. You might surprise yourself. You might go up half a size than you would think you really are. So especially if you're going to make an investment in an expensive shoe, you definitely want to try it on towards the end of the day.
So not at lunchtime, maybe wait till after work.
Right, evening.
Gotcha. Okay. What else about women's shoes? Let's talk a little bit about some of the problems that wearing those kind of shoes excessively can have. Can you tell when a woman comes in the office what kind of shoes she's been wearing for the last?
Yes.
How can you tell? What are some of the things that telltale signs?
A couple of things that really stand out are corns and calluses, especially on the ball of your foot right underneath there, and on the little toe and on the side of the great toe. Usually means someone's wearing a very narrow cut shoe, which usually relates to high heels. If you take a look at that person, you ask them, they're like, oh, I'm in heels all day. It's a giveaway. Dry, rough skin on the heels too is a lot of times equated to the high heels as well. But most of the time it's that ball of the foot pain or nerve pain in between the toes. That's a chronic person who wears high heels all the time.
And what kinds of treatments exist for these kinds of common problems?
Well, the calluses, we professionally trim them. We get you to try to change your shoes. You can also get that orthotic to put in your shoes to kind of displace your weight a little bit. But the best thing to do is just rotate your shoes. Wear your high heels half an hour, an hour. No one's saying don't wear them completely. Just wear them in moderation. Some people, they put them on while they're sitting at their desk at the computer. That's fine. When you actually get up and walk around the office, maybe you want to switch into your flats.
Okay. Before we go into our next topic, just a reminder, we are taking your calls at 312-738-1060. And if you do need a referral to a podiatrist, visit the IPMA website. That's ipma.net, or call our 800 number, which is 869-3338, right on the sign there below. So you also mentioned when you described your practice, some of the cosmetic treatments and procedures that you do, and I'm guessing, I could be wrong, that most of those patients are women.
A lot of them are women. I'm not going to say men don't care as much. They do. It's just they are not as forward about what's bothering them sometimes.
I was shocked when you told me that some men that got pedicures.
Yeah. Some people are very forthright. Most men, I've noticed, are not as much. But some of the cosmetic things that are pretty popular today is laser treatments for fungal nails, spider veins, hair removal, and treatment of things like skin tags or warts on the feet. Reason why the laser is so popular is because it's quick, it's easy, there's no downtime, it's relatively painless. You don't get side effects of taking pills, and you don't also spend years putting on creams on certain things that it's not going to do anything for you.
Tell us a little bit more about the laser. You mentioned a term I had not heard before, skin tags?
Yes.
What are those?
Some people have just, skin tags are loose areas of skin that a lot of people see them at the neck, and sometimes it's due to friction, but believe it or not, as you get older, you can have some on your feet and ankles too. So the laser, just one zap, it's gone. It's great.
And how long have you been working with this device?
I've been using it for 2 years. The results have been wonderful. I really haven't had any issues with it. Probably the most significant one is the fungal nails, but secondarily is the spider veins, the unsightly veins. That's really nice because when you're doing the laser treatment, they actually disappear in front of your eyes. So it's really rewarding for myself and as well as the patient, because you can see it just go away. Your problem is solved.
I've seen this, one of the devices demoed before in a podiatrist's office, and it's very painless, and the patient just sits in the table and puts her feet in the little the stirrup-like area, and then just waits 10 or 15 minutes sometimes, depending on the procedure.
Right, and of course depending on the laser. But basically that's the essence of it. Whether you're putting your feet in stirrups and kind of waiting for the laser to take effect, or your podiatrist is doing one nail at a time or one vein at a time, it's really, really painless. The great part is you just walk out and you're done.
Now, for a woman that might have toenail fungus, could she get that taken care of at a salon as well? Are there other treatments for that, or is
no? And in fact, if you're at a reputable salon, if they notice anything that's different about your nails, that they're thicker, they're turning white, maybe they're turning green, they should actually not be treating you. So if you are at the salon and you see someone next to you with dicey looking nails, this might not be the best place for you. One thing that I do tell some of my patients is they're not going to stop going to the salon by any means, and they want to bring their own instruments, they do everything, but they're still cautious. You may want to consider avoiding those whirlpools too, and just getting a polished change, which is half the price. They do a great job, it looks professional, but you're not soaking your feet in maybe a questionable whirlpool in which there's water that gets recycled through the pipes over and over again.
And if a woman buys her own instruments, what's the best way to take care of them at home? Just regular soap and water?
Boil. You should boil them if you can. I mean, some people do use bleach and things like that, but that'll ruin the life of your instruments. So boil them, alcohol them in between if you haven't used them for a while, and keep them in a separate baggie, a Ziploc baggie, and then you're safe.
And dispose of the things that, like the emery boards and
Yes,
things like
regularly.
that,
Yes, regularly.
that you're not going to use again.
Mm-hmm.
Tell me a little bit about some other things that are coming down the pike for you and your practice. You're experiencing a lot of growth in your practice. Is there one particular patient area that you see a lot of growth in?
I'm seeing a lot of diabetic patients recently. Basically, there's just been, I think, an increase in people who have been diagnosed with diabetes in probably the last 10 years. It seems to be a pretty common ailment these days. So people are more proactive, starting early, of taking care of their feet, seeing a podiatrist, having a podiatrist they can call on in case there's a problem. I think primary care doctors are telling more people that, this is important. You want to keep the life of your feet, and that's what you need to walk for the rest of your life, no matter when you've been diagnosed with diabetes. So I've been seeing a lot of that. I've also been seeing a lot of small children with in-toeing or out-toeing issues or flat feet, mostly because it's the school season and parents are being told either by their teachers or a health professional that maybe they should get that checked out before the kid starts getting older.
What age are you seeing those kids at?
Probably starting around the age of 4 to about 7. It seems very, very common these days. So I think it's a good job in terms of the schools of recognizing things a little bit quicker is what I'm seeing.
And do you typically take sort of a watchful waiting approach with these kids, or do you opt for intervention?
I try to do conservative intervention pretty early, some type of insert or shoe change if I can, if they really need it. Some people, you do have to watch. It's not really something to worry about, but we'll keep an eye on it kind of thing.
Do you do sort of gait analysis sometimes?
I do. It's a little tricky with the little ones, but they eventually, we get them to walk around without thinking about it. But I do a gait analysis and watch how they're walking and how their feet lie. And we try to do some x-rays too if we're really concerned about the bone placement of their feet.
And getting back to diabetes, we'll just close out with this. Have you diagnosed previously undiagnosed patients with diabetes? Have you seen things in their feet?
Yes, once, a couple of times. And most people, I think, are very thorough with their health care in my office, but I have caught it once or twice where their skin was drying out. They had very dry patches on their legs. They increased their weight, and then they would complain about feeling awfully tired or very thirsty, needing to use the bathroom a lot, and then we suggest some blood tests for them to diagnose them. But it's not as often. It's usually the other way around, that they're diagnosed first and then come into the office.
Do you, in Evergreen Park where you practice, do you often find that you're part of sort of a multidisciplinary team of healthcare providers that treat people with diabetes?
Yes, I'm very fortunate to be near some great hospitals in the area and some very great primary care doctors and specialists. So we kind of have a great dialogue of talking between each other about certain patients. And what I've noticed in our neighborhood in particular is people like to stay close by and close to their home, so they like to keep their doctors close by. So it's nice. It's a great way to know the other doctors in the area as well, and it's a better comprehensive care for the patient.
That's great. That's great. Well, it's been a pretty interesting post-Valentine's Day wrap up. For all you guys that are still in the doghouse, maybe a nice salon gift certificate in case you overlooked the biggest day of the year for you guys. Come on. So thank you again for tuning in. We'll be here next month. Again, if you need a referral to a podiatrist, visit the IPMA website. That's ipma.net, or call us at 800-869-3338, and we'll be happy to refer 2 or 3 podiatrists in your area to you. They're all IPMA members, very reputable folks, just like Dr. Pandit. So thanks for coming on,
Thank you.
We'll look forward to seeing you again soon.
Great.
All right.
Thank you.